Good afternoon. My scenario is a 27-year-old male farm worker who cut his elbow on a sharp metal object. So some suturing indications would be wound closure of clean wounds with minimal tissue loss. It would be operative closure, of course, and securing drains and lines. Some absolute contraindications would be like deep puncture wounds, lacerations through burns or infected tissue, animal bites, or wounds that are grossly contaminated with debris. Some safety considerations, of course, my hands have been thoroughly cleaned. I'm wearing sterile gloves. I have my sterile field prepared as well as all my equipment. Some things to consider, of course, this is a dirty wound. It happened in the outdoor setting, and so we would immediately start weighing out antibiotic prophylaxis, tetanus prophylaxis. Again, he has no pre-existing conditions, so we would just weigh out whether or not he has been vaccinated in the last 5 years to determine prophylaxis. I will heavily consider secondary intention of closure, whether or not we could use something like tissue adhesives or like steri strips, skin glue, anything of the such. We would absolutely inspect the wound for debris. We would irrigate and cleanse the wound thoroughly. On assessment, inspection, we're looking for any like retained objects. We're looking for materials like metal. He cut himself on a metal object. We're not sure. He might have some metal retained pieces. We might need some like radiographs. We have thoroughly cleansed. We have locally or regionally anesthetized the area, and we have, of course, discussed the process with our patient and what he can expect. I have already selected my specific type of suture material as well as the suture technique. I will be using the nylon monofilament 4 for this area, using as well as the simple interrupted suturing technique, which of course allows for precise wound closure and approximation of the wound edges. This kind of suturing technique is ideal for this kind of wound. It's like on an extensor joint, there's a lot of mobility to the site, and so if there would be failure of one suture, it wouldn't affect any of the others, like any of the running techniques or other techniques we've learned. So yes, I am using a nylon monofilament, and then the nylon, it has excellent tensile strength for this area of high mobility. The monofilament threading or suture material I would use because it decreases the risk of infection. Of course, we're highly considering infection in this scenario because of the circumstances of the laceration, the cut, and so we will begin. I again thoroughly answered all of the questions, and everybody knows what to expect. I have the nylon monofilament. I have my driver here, and I'm going to load the needle onto the driver at a 90-degree angle. I have my Adson forceps here, and I will just start to drain. So I will start on one side, just going in at that 90-degree angle, going in at the site furthest from me. And then you want to do it in one bite. And I'm sorry, I'm just going to hold the skin here. I'm going to pull the suture until about 5 centimeters of the suture is left. I'm being careful always with the needle, of course. I'm going to do a like a surgical knot, a surgeon's knot, starting away from me and bringing it in. Inwards, towards away, away, towards. This is my third throw. Okay, do like one more. Oh, no. And this is towards, away. It's my fourth throw there. So we want to be careful not to make them too tight, of course, because that could affect wound healing. If the wound or the wound edges are too approximated, that can cause damage to our wound healing. So we want to just, I will again being very careful with the needle, load the needle onto the driver at a 90-degree angle, using the Adson force. So I could just go back in, taking another bite, and I pushing this through, always being very, very careful with the needle, leaving another 4 to 5 centimeters exposed so that I can complete another knot using another 4 to 5 throws, starting away from me again, not being too tight, closest to me, pulling away, not too tight, away, closest to me. That's 3 throws. Could do like a 4th, closest to me, away. Beautiful. So hemostasis has been thoroughly achieved, and of course these sutures will help continue hemostasis, making sure that it remains. Loading the needle on the driver again, taking another bite. Being careful to only touch the needle or hold the needle with the driver itself and never the Adson forceps. So we'll do another knot here, starting away, bringing it towards me, away, away, towards me, and towards me, away. And we'll do one last one before the time runs out, so that you could see that I love these sutures. And it's also the standard suture technique, so this is probably the one that will be done most often. Unless, of course, we're considering like cosmetic appearances, and like anything, situations determine course of treatment and who's called. And techniques and materials, and starting away, bring it towards me to away, towards me. Of course, we're making sure that none of these are too tight. We're making sure that all the knots are on the same side. We've weighed out antibiotic prophylaxis. We have also weighed out tetanus prophylaxis. We will inform our patient on how to care for the wound. We can also weigh out like topical antibiotics like mupirocin, things of the such, and as well as planning out suture removal within 10 to 14 days. Thank you.